Hi guys, my name is Soba Mike. I teach human anatomy and physiology at College of Nursing Sciences, Adazi, and Millennium College of Nursing Sciences, Oka. In this video, I'm going to be discussing with you a few things I feel you should know about heart attack. Please subscribe to the channel, like this video as you watch. And the first thing I want you to know is that heart attack is one of the #1 killer diseases in the world, and you have to do something about it. According to World Health Organization, heart attack and other cardiovascular diseases are the leading causes of death worldwide. Like 17 million people die every year from these diseases, and heart attack is the most common of them. So you have to do something to prevent heart attack. Now, the second thing I want you to know is heart attack. The heart is a very vital organ. It pumps blood to every other organ in the body. So the heart pumps blood to the kidneys, the heart pumps blood to the liver, the heart pumps blood to the intestines, the heart pumps blood to the lungs. Like every organ in the body depends on the pumping action of the heart. And this blood that the heart pumps contains the essential nutrients that the body needs to survive. The blood contains oxygen. The body cannot survive without oxygen. The blood contains nutrients, glucose, amino acid, vitamins, water, everything. If you take drugs, this drug will be found in the blood that the heart pumps. So any organ that is deprived of this pumping of this blood from the heart will not survive. The tissues and cells of that organ will be deprived of these essential nutrients, and then they will die. If the tissues of an organ dies due to lack of blood supply, that death is called infarction. Number 3, heart attack is called myocardial infarction. The real name for heart attack is myocardial infarction, and this name tells you everything about heart attack. Myo means muscle. Cardial refers to anything related to the heart. So myocardial means heart muscle or muscle of the heart. Then infarction, like I said earlier, is a death of tissues of an organ due to lack of blood supply. So anything can lead to the death of tissues of an organ. If that death is due to lack of blood supply, it is called infarction. So myocardial infarction, which is heart attack, is a death of muscle tissues, muscle cells of the heart due to lack of blood supply. And these muscle cells are the ones responsible for the pumping action of the heart. So when they die, how do you expect the heart to pump blood? So when blood is not being supplied to the heart, the muscle cells of that heart will not have access to oxygen, they will not have access to glucose, they will not have access to all those essential nutrients. And those cells, those tissues will begin to die due to lack of blood supply. And that death is called infarction. So heart attack can also be called myocardial infarction. Number 4, the real cause of heart attack is blockage of the coronary artery. You heard me. The real cause of heart attack is blockage of the coronary artery. So there's something I need to let you know. Every organ in the body has an artery, one or more artery that supply blood to that organ. Now, the artery that supplies blood to the heart is the coronary artery. The coronary artery is the mother of the heart. So oxygen gets to the heart tissues through the coronary artery. Nutrients like glucose, amino acid, vitamins, roughages, all get to the heart tissues through the coronary artery. So if anything happens to the coronary artery, which is a case in heart attack, all the cells and tissues of the heart will no longer have access to these vital substances. Now let me just show you. We have two coronary arteries, the right and left coronary arteries. The right coronary artery takes the blood to the right chambers of the heart, while the left coronary artery takes the blood to the left chambers of the heart. Now, if you look at this model of the heart I'm holding here, you can see all these the red vessels you can see here. They are various branches of the coronary artery that takes the blood to the various areas of the heart. Now, if any of these branches get blocked, that area of the heart that is being supplied by that coronary artery will no longer have access to this blood, will no longer have access to these things. So the cells in that area will begin to die, and they will not be able to pump blood. So that's exactly what leads to heart attack. So heart attack is caused by, the real cause of heart attack is blockage of the coronary artery that supplies blood to the heart tissues. Number 5, cholesterol and blood platelets are the real reasons, are the most common reasons why the coronary artery gets blocked. So there's something about cholesterol. It is actually useful. It's useful in the body. Like it is used for making cell membranes and even some hormones in the body. But sometimes it can be very annoying, like the bad one can be very annoying. So cholesterol has this ability to stick to the walls of arteries. It has this ability to form deposits on the walls of arteries known as plaques. And this deposit actually reduces the quantity of blood that is meant to flow to the organ that the artery supplies. And the most attractive artery to cholesterol is the coronary artery. So if you have high levels of cholesterol in your blood, there are chances that this cholesterol has already started forming plaques, that's already started forming deposit on the walls of your coronary artery without your knowledge until you go and check it. So the reason why you're not feeling it is because you still have some quantity of blood moving to your heart tissues. So the only time you will feel it is when it is completely blocked. So there are chances that cholesterol has already started building on the walls of your coronary artery, but you're not aware of this. Now, if anything happens to this plaque that is formed by cholesterol, if it breaks, blood platelets, which are cells that are responsible for preventing blood loss, will rush to that area. So there's something about blood platelets. These cells are responsible for preventing blood loss. So if you have an injury, platelets will rush to that area. They will accumulate in that area to reduce the loss of blood from that injury. So when they notice any abnormality in your blood vessel, they will rush to that area. So if the plaque formed by cholesterol breaks, they will think there's an injury. They will think it's an injury. So they will rush to that area and then accumulate in that area and then completely block that area. So blood will no longer flow to your heart tissues. And as a result, your heart tissues will be deprived of oxygen, you'll be deprived of nutrients, you'll be deprived of all the essential substances that they need. And of course, they will die through infarction. And if your heart tissues dies, if your heart tissues, which are mostly muscles, die, they will no longer pump blood and your heart will go off. So when your heart goes off, all other organs in your body will be affected. So the most common cause of this blockage is cholesterol and blood platelets. Number 6, stress, fear, bad news, or heartbreak are not the direct causes of heart attack. So these things are just triggering factors to heart attack. So for you to develop heart attack because you heard someone is dead is because you've already started accumulating cholesterol in your coronary artery. If you experience stress can lead to high blood pressure, and this high blood pressure means there is high speed of blood in your arteries. So when there's this high speed of blood in your arteries, it can actually lead to that clot, that plaque breaking. It can actually cause that plaque to break. And when this plaque breaks, platelets will now rush to that area to block it. So these things are just indirect causes of heart attack. They are not the direct cause of heart attack. So they can lead to high blood pressure. And then when there's high blood pressure in the coronary artery, it can actually break this cholesterol deposit. And when the cholesterol deposit, these plaques are broken, platelets will now rush to that area, then block everywhere. So that's why these things can actually lead to the final stages of heart attack, but they are not the direct causes of heart attack. Number 7, heart attack can be prevented. Yes, and the best time to prevent a disease is when you are still healthy. And that's what makes it very difficult, because it looks funny to go to the hospital when you are still healthy. But the best time to prevent a disease, example heart attack, is when you are not experiencing it. Like I said, a lot of persons moving on the street have already started developing heart attack. They have a coronary artery that have already started accumulating cholesterol. So it is better for you to go to the hospital and then find out the status of your coronary artery. So if you go to the hospital, they can ask you to do some blood tests to find out the quantity or the levels of cholesterol in your blood. So if there's high cholesterol in your blood, there are chances that it has started forming deposit or plaques in your coronary artery. They can also ask you to go for X-ray. So X-ray will actually give you a picture of your coronary artery to see how it looks. If there are deposits of cholesterol in them, then the other things you can also do to prevent heart attack. You can also exercise more. So exercise actually burns fat and then reduces the levels of cholesterol in your blood. Then you can also watch the kind of food you eat. So eat more of plant-based food. So reduce the intake of meat, reduce the intake of eggs, reduce the intake of bread, reduce the intake of butter. So all these things are rich in saturated fat, and they can increase the levels of bad cholesterol in your blood. And finally, heart attack can actually be treated. So if you go to the hospital, but it has to be done immediately. So that's why prevention is better. So if you go to the hospital, they will give you some drugs that will help to dissolve this plaque that have been formed by cholesterol. Then depending on the severity, they can insert some instrument, they can insert some tubes into your coronary artery to remove, to open it for blood to flow into your heart tissues. But it has to be done immediately. So heart attack can be prevented and it can be treated. Now let me not forget the most common sign of heart attack is chest pain. So heart attack is a kind of silent killer. You might not really know that you have it. So but the most common sign is chest pain. So thank you so much for watching this video to the end. If you learned anything, please give me a thumbs up by clicking on the like icon on your screen. Then if you like this kind of content, if you want to watch this kind of content in the future, just subscribe to this channel by clicking on the subscribe icon on your screen. If you have questions, just drop them on the comment section and I promise to answer them. Thank you so much and see you in my next video.